Aaron and Melissa here. You've surely heard a lot about this. The attempt to restrict parents' rights over vaccinations, states, and even a federal bill now saying they want to eliminate the philosophical exemption for vaccines, at least for kids going into Head Start, the poor kids who have to get federal assistance. That's the bill with Barbara Boxer and Representative Anna Eshoo. There's also at least a dozen states who are looking at strengthening the vaccine-related legislation restrictions in their states. Pretty much most of them doing away with the religious and or philosophical exemptions. And you got California, Maine, Michigan, Minnesota, Mississippi. Montana and New York are allowing more freedom with vaccine exemptions. But all these other states, South Dakota, Oregon, Vermont, Washington, West Virginia, Texas is not even on this list. All of them are looking to restrict parental rights with vaccines.
Texas is talking actually about, they just started mentioning it on Friday. They're going to try and do that as well.
But the big test case is the California bill that wants to take away the philosophical exemption. Meanwhile, this family in California is saying, because my kid has child cancer, because he's recovering from leukemia, he wants the schools to bar any children who aren't vaccinated from attending public school. Do it for the kids. Do it for this cute little kid with cancer, the Crowett family. And here he is presenting himself. Let's play just a second of this.
He will say, "Gone with the measles."
Leukemia survivor Rhett Crowett will be getting his measles shot in a matter of days. It'll be 1 year since his last chemo session, and doctors say he'll finally be well enough to withstand the vaccine.
And so they've been making the argument that because he's recovering from leukemia, he can't get the vaccine, and he's at risk because of all the unvaccinated kids. First of all, one of the major flaws with this is here's a Johns Hopkins hospital patient information sheet about what to do when you're immunocompromised and you're recovering from chemotherapy from cancer. And they say right here on page 113, can I have visitors? No. Tell friends and family who are sick or have recently had a live vaccine, such as chickenpox, measles, rubella, and the influenza, smallpox, or polio vaccines, not to visit. Avoid contact with children who are recently vaccinated. So it's actually not a good idea for everyone to be vaccinated and be around children, especially who are recovering from cancer, who've been through chemotherapy, who've had leukemia. So not a good example for Rhett Crowett and anyone like him. He needs to probably stay home because unfortunately the public school is surrounded with vaccinated kids, but they want to point the finger of shame and blame at the families who didn't vaccinate because they're educated or partially educated or even have heard rumors that make them upset.
And they want to use this little kid to do it. They're trotting out a 7-year-old and they're prostituting him for their agenda. It's disgusting.
Well, the other thing that's not disclosed is this man right here, his father and his mother. They're right here in this wedding announcement from 2003. She's Jody, he's Carl Crowett. They don't disclose that Carl's father, the bridegroom's father, is Dr. Edward Crowett, a doctor in Vermont who has ties to the vaccine industry. He's a gastroenterologist, and he has taken donations year after year and been paid as a consultant by GlaxoSmithKline.
Who make an MMR vaccine.
They do. It's not the main MMR, but they're totally in the business. Here he is here in a scientific paper for hepatology. He specializes in hepatology, Dr. Edward Crowett. Potential conflict of interest. Dr. Crowett is a consultant for GlaxoSmithKline, and his colleagues have all these potential conflicts of interest as well.
Pretty much every pharmaceutical company ever. That little kid's grandpa is a consultant for GlaxoSmithKline that makes an MMR vaccine, and they're trotting him out up there. Like, look at this poor kid with cancer. Everyone should have their rights taken away because of him. His grandfather's a consultant for Glaxo.
And I've seen dozens of stories about this kid that not once have they mentioned that his grandfather's a doctor.
Well, of course not. Why would they mention that? That would be honesty and integrity, and that's not what's going on here.
And so meanwhile, let's take a look at who's introducing this bill. It's at about 40 seconds here. Got to get a cue.
Pediatrician and State Senator Richard Pan is...
It's pediatrician and state senator Dr. Richard Pan. He's both a state senator in California and a pediatrician. Let's look into
Pediatrician
him.
State Senator Richard Pan is the bill's co-sponsor.
The rate of adverse effects from vaccination is much less than the disease itself.
Marin County has the state.
So he says it's great, and he wants to make it mandatory for all kids to get vaccinated unless they have a doctor's medical exemption, and do away completely with philosophical outing. And he's all over the news for introducing this. They're saying it's so great. Guess what he didn't disclose as he's telling people to get vaccinated? He didn't disclose that he's been totally bankrolled by Merck. In 2010, Merck paid at least 25 senators and assembly people in California, including Dr. Richard Pan, he was an assembly member then, today he's a senator, to introduce a mandatory HPV Gardasil bill in California. Isn't that lovely? More recently, as he's run for Senate, Dr. Richard Pan has taken money from Merck, he's taken money from GlaxoSmithKline, and he's taken money from pretty much all kinds of pharmaceutical companies, a rather long list, and of course all types of people in the health industry as well.
And Monsanto.
Oh, and
I mean,
Monsanto.
the guy is taking. He's a team player for Team Corporation USA, basically.
So
and he's standing up there proposing all of these bills.
And they're going to take away parents' rights. They're going to tell you that you must get shot up with anything that the CDC recommends you get shot up with. Doesn't matter if it's been safety tested, if it's a sham safety test, if they've overlooked data sets, hid things under the carpet. Some pediatrician who's in the Senate getting paid off by special interests, who he's also gotten paid by in private practice, is going to tell you have to take it. And some unfortunate kid who's suffering cancer is being prostituted by his own family who have ties to the vaccine industry. Isn't that shameful?
I mean, when has this ever worked? When has this ever worked to limit people's rights just a little? We're just going to infringe on your rights just a little bit, and that'll be okay. That's not a slippery slope into total medical tyranny or anything. We'll just infringe a little here and there. It never stops there. Why don't people get this? If they can do this for something like measles, this is not where it's going to end. And people need to realize that everything you watch on TV, including the cute little kid with cancer, is a big fat wag the dog in your face manipulative agenda to get whatever the government's trying to get done, and it always ends in taking away your rights. That's pretty much how it is.
It's disgusting.